Now it's up to California's 58 counties to adopt these guidelines or create some sort of version that they want in their counties.
Well, tonight we checked in with those who would be benefiting from this expanded reopening, and we also talked with medical professionals about what this all means. KRON 4's Dan Kerman live for us now in San Francisco at the Moscone Center, that mass vaccination site there. He has the latest for us tonight. Good evening, Dan.
Good evening, Justine. You know, it was just earlier in the week that we told you about the first conference being booked in San Francisco for late September. These guidelines are just the first step in making sure that that type of conference can happen. You have to go back a year to remember when meetings and conferences were still being held. But if counties like San Francisco adopt these new state reopening guidelines or some form of them, it clears the way for the return of meetings and conferences.
This is a really important step to start to get the meeting industry back on its legs again.
San Francisco Travel President and CEO Joe D'Alessandro says the number of people allowed could be a bit higher, but he says this is a great start to safely bring meetings back to the city, which will recharge the economy.
Meetings are really the driver, the economic driver of that midweek business, which is absolutely critical for small businesses, for restaurants, for everybody that relies on people every day of the week.
The new guidelines, if adopted, could also mean the reopening of big and small event spaces like the 111 Minute Gallery, which due to COVID has mostly been doing online art shows and artist interviews.
We obviously want to be open as a business. We want our business back open, but we are very cautious.
Michelle Delaney says she hopes to begin to open up in the alley outdoors first, and then as more people are vaccinated, move inside. Caution is something medical experts say is a good idea.
As we reopen things, you know, I think you need to do your own sort of risk assessment, self-risk assessment. And if you're 85 years old and have numerous underlying risk factors. If you're a pregnant woman, I think you go slow on these things and be careful and not put yourself at risk.
Medical professionals say just because something is open doesn't mean it's right for you to attend. That is what they are saying. You need to assess yourselves as more and more of these things start to reopen throughout the state of California. Live in San Francisco, Dan Kerman, KRON 4 News.